Diabetic related issues in the eye, I have mentioned there are various effects of diabetes on the eye, like change in refractive error, development of cataract, development of glaucoma, and diabetic retinopathy. Now, retina is a structure of eye because of which we all see everything. The world is seen because of the retina. Retina is like a film of the camera. So, because of diabetes, there are diabetic retinopathy is in we have as a medically we divide diabetic retinopathy into non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. In early stages of diabetes or those who have diabetes for less duration, in such patients we do find non-proliferative diabetic retinopathy. In that case, the changes in the retina are minimal. Most of the time patient comes to us, a diabetic patient comes to us without any visual complaint, but such patients also should examine their eyes. The need is because most of the times they are not aware that their retina is getting affected because of diabetes. Unless and until we put drops in the eye, dilate the pupil and examine the retina properly, we won't find that patient is having diabetic retinopathy in non-proliferative stage. If a person is having diabetes for longer duration, say for more than 5 years or for more than 10 years, then the risk of developing proliferative diabetic retinopathy increases. I have already mentioned previously how there is extravasation of blood in the retina which leads to swelling. Now, in the retina, there is a most sensitive part called as macula. So, with this macula, we see everything. The whole world is seen with fovea and macula. So, if there is a fluid which gets accumulated in this macula, there is a formation of cystoid macular edema. And because of this cystoid macular edema, the vision of the patient again gets reduced in diabetic patients. So, in diabetics, there are various stages of retinopathy: non-proliferative and proliferative retinopathy. There is also a diabetic maculopathy. There is a diabetic macular edema. So, unless and until a diabetic patient undergoes a thorough ocular examination, a doctor won't be able to tell him whether you are having retinopathy or not. So, in diabetic patients should get their eyes checked frequently.